All right, welcome back. It has been roughly 1 year since the coronavirus pandemic hit, making a major impact on all of our lives. Joining me live now is Dr. Hammad Haider-Shah, Chief Medical Officer at Aurora West Allis Medical Center. And Doctor, 1 year into this pandemic, what lessons have hospitals as well as medical professionals learned?
So I think there's quite a few lessons. Number one, I think one thing I think is our team members and our commitment of our team members, our caregivers to taking care of our patients, really running towards the disease and helping, not knowing initially what to expect or even how to keep themselves safe, and working and committing themselves to our patients. And then, the other key is, just our culture of safety and safety driving all decision making. Part of that is making sure we have enough PPE, making sure that our team members were well communicated with, especially as we moved away from in-person to virtual meetings as well. Even here in the hospital, communication is such a huge part of making sure our team members were aware of what it is we were doing, what was going on globally, treatments that were available, testing capabilities, and the amount of PPE that we have. I think the other thing is valuing, Aurora, becoming Advocate Aurora, and having that larger scale. That key in scale was able to put us in the right position when it came to testing, to telehealth, to shoring up our PPE, because it was very short early on. And then looking at our safe care promise over the last 1 year, doing everything we can to make sure every single patient that walks in the door is kept safe as well, and really taking care of them, especially in a time where I think for a lot of our patients, it was difficult, even for our team members, of not having visitors during a lot of the year as well. And so being able to connect with families, especially at end of life, but even during the times where patients were in the hospital for surgery, and normally we're used to having family members there to be there, and our team members stepping up, holding patients' hands, talking to them, talking to family members a little bit more frequently, knowing that they couldn't be here in the hospital.
Definitely, COVID changed the way we operated. One thing you brought up, you said advocacy. This disease definitely brought attention to the disparities of those with pre-existing conditions. In the health industry, how do you think that will change the conversation of dealing with a lot of those pre-existing conditions to get people better in health, so that if a pandemic should hit again, we don't see these disparities?
Yeah, so I think that one of the really great things is telehealth itself, is being able to go to the patients rather than having the patients come to us. And I think that's going to continue going forward. I think we did over 1 million televisits over the last year, which is huge. We did very few prior to that, so that connection is key. Talking to their physicians, being able to connect, helping them through their disease, even connecting with a dietitian or connecting with a physical therapist, where you may not be able to come in, but we can still do the exercise, teach you how to do that, teach you how to take care of yourself. So I think that's a key learned lesson of how we can work differently, knowing that a lot of patients with pre-existing conditions are not always able to touch us in the same way they were previously as well. So that's definitely part of it. And then I think the other key is just learning the importance of listening to our patients very closely and finding out some of the issues that they're having. So it's beyond just healthcare, looking at, how do we get them with the right resources? Maybe it's diet, maybe it's getting to the right grocery store, getting them to the right places so they can help themselves live better as well.
Dr. Haider-Shah, thank you for your time and this look at what is in the future for us once we get through this pandemic. Again, you can